Today we're going to discuss what are the symptoms of chronic kidney disease. Introducing myself, for those who are here for the first time, I am Dr. Francisco. I am a specialist nephrologist and a transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the bite-sized information for kidney and related diseases. This video blog is destined to help patients with kidney problems or at risk of kidney problems or their relatives to be better informed so they can take better decisions regarding the medical care, which can minimize complications and worries. And you can have also better discussions with your doctor or with me if you choose me as your doctor. So, what are the symptoms of chronic kidney disease? As mentioned in the previous video, chronic kidney disease per se has no symptoms, especially in the earlier stages. And many conditions affecting the kidney do not have symptoms either. This means that many patients are not aware that there is an ongoing problem in the beginning or in the middle of the disease. So the disease can remain getting worse and worse and complicated. But as the disease progresses to a certain level, the kidneys cannot perform anymore the functions that normally do. Largely, they cannot clean the blood and control the water and salt levels. And the problems with controlling these two functions are the main reasons causing the majority of symptoms in kidney patients. As the disease progresses, patients cannot control the water content of the body. So the patient starts retaining fluid, especially in the legs. This can be very annoying, making the legs feel very tight and heavy. And the patients are unable to wear their shoes normally or even walk with comfort. If this is severe, the skin can break and form blisters, predisposing to skin infection, what doctors call cellulitis, worsening the problems the patient already has. If the fluid retention increases, the patient can become breathless and easily fatigued. So it is difficult to perform the normal activities. And patients with severe fluid retention can feel breathless, especially in the middle of the night, needing to sit up to catch up the breath, or even needing to go to the emergency department for treatment. With excess of fluid in the body, the blood pressure can also go high. This can cause headache to the patient, making him or her feel uneasy, and in the long run, this silently can damage many other organs like the brain, the heart, the eyes, and further the kidneys. But true, if the blood pressure goes sky high, can endanger the well-being of all those organs and even the life of the patient. As the toxins levels start building in the blood, the patient can also feel very weak and very lethargic, having nausea and vomiting and severe itch. The patient can also start losing weight and flesh, muscle. The patient can find difficult to concentrate in their daily activities or to remember things. And it is also difficult to reconcile a good sleep. The patient can also become anemic, meaning having low concentration of hemoglobin in the blood or red blood cells. This is caused because the kidneys, when they are ill, they are deficiently producing a hormone called erythropoietin, which function is to produce red blood cells. And the red blood cells carry this hemoglobin, and the hemoglobin carries oxygen to the rest of the body, and all the body needs oxygen, as you know. Anemia also contributes to the weakness experienced by the patient. Occasionally, the level of anemia can be so severe that can impair many functions of the body, because all of them, as mentioned, require oxygenation, and occasionally can trigger major complications like a heart attack. To prevent anemia, some patients must have erythropoietin injections and iron supplementation. Patients can also have bone pains, bone deformities, or even fractures because the diseased kidneys are not helping in the activation of a hormone called vitamin D, which is necessary for calcium absorption and to make the bones stronger. In addition, patients have problems to control the levels of phosphorus in the body and other minerals like magnesium. When the disease is advanced, there can be imbalances in the blood levels of many other salts or electrolytes like potassium, sodium, calcium, and magnesium. Many patients do not have symptoms because of that, but many others can have erratic rhythm, erratic beatings of the heart, what it is called arrhythmias, or they can feel dizzy. Also, problems of sodium, calcium, potassium, or magnesium can be life-threatening, especially in advanced stages. Finally, the blood can become very acidic, which worsens many of the symptoms already experienced by the patient and can impair further the function of many bodily organs. In Francisco Kidney Medical Center, we aim to keep our patients well informed about their symptoms and potential complications. I know that this can be very scary, but it is ideal to be aware of it so the necessary preventive measures can be put in place. I hope you found this video useful. Please share the existence of this group and this blog with your friends and family. Dr. Francisco wishing you the best possible health. Take care. Bye-bye.